So the endocrine therapy and chemotherapy for hormone-positive early breast cancer have remained similar for decades. So, and for high-risk patients, no further treatment have demonstrated significant clinical benefit. So would you share with us any new clinical data that might give us paradigm shifts in this patient population?
I think we've seen a lot of changes in the luminal early breast cancer space, and you know that my research also has a focus in that area, and I think we have to realize that we need thorough risk assessment and assessment of endocrine response as a prerequisite for the state-of-the-art therapy in this space. So we've learned to de-escalate and omit chemotherapy whenever it's not needed, but also to escalate for those patients who are still at considerable risk despite of chemo and endocrine therapy. And luckily, we've recently obtained these 2 new approvals for additional therapeutic options. And one of them is the CDK4/6 inhibitor abemaciclib. It's for node-positive high-risk disease and for patients with a BRCA mutation and also high-risk HER2-negative early breast cancer. We have now olaparib approved. So with these 2 options, I hope that we can sort of lift up the Kaplan-Meier curves for these high-risk patients. And let me just say that I think that we tend to underestimate risk in this luminal early breast cancer space because we